What about the HER2 low category and brain mets with TDXD?
So yeah, great question. We started moving this drug, of course, carefully, first gathering data in HER2 positive breast cancer, and then gradually moving towards HER2 low. And what we are seeing is that we have very preliminary data suggesting that actually TDXD is quite effective also for patients with HER2 low brain metastases. There is the trial that I mentioned before, DAISY, that also had some patients with HER2 low brain metastasis, and there actually was between 30 and 40% response rate with a waterfall plot similar to the one you're seeing in this slide right here. And the same was observed in another cohort, because the DEBRA trial that also we're seeing here was a Spanish study that had several cohorts. It enrolled patients with HER2 positive, HER2 low, and different types of breast cancer. And it also had a cohort of very few, 8 patients with HER2 low brain metastasis. But among these 8 patients, there was 40% response rate. So in general, what we're seeing with this drug is very consistent, is that it can penetrate the brain, and you can see activity in the brain with this drug more than you traditionally observed with conventional chemotherapy. Of course, it is never 100%, unfortunately, and this is why we are studying very hard this phenomenon, and also we are expanding these cohorts. Of course, you cannot understand too much from 8 patients, but this at least gives you the optimism to expand it and to treat more patients with this drug. And we are treating patients with HER2 low metastatic breast cancer with brain mets, with TDXD, and we are seeing responses. And for instance, one thing that was also nice to see is that we conducted this real world cohort of patients with leptomeningeal disease. There is one of the hardest sites of disease to treat when the tumor goes around the brain. And actually, we saw that there were promising responses and ongoing responses in patients that we treated at Dana-Farber or at Duke. So it's very early. We are accumulating this data day by day, month by month. But I would say that all of this data create a very consistent picture of a drug that works very well, of course, not in 100% of the patient, but much better than traditional chemotherapy. And so once we optimize the way to use this drug, I think we can exploit its benefit even more and for a larger population of patients.